Bismillahirrahmanirrahim. Very fine good morning to all the participant organizers of the Brain and Biomedicine International Conference organized by Department of Physiology, Government College, University of Faisalabad. I'm Dr. Syed Haroon Khalid, working in University Technology, Mara, Malaysia. I'm very thankful to the principal organizer, Dr. Ghulam Sen, who is inviting me as an invited speaker for this prestigious conference. So afterward, I will share my today's presentation for this conference. So now I'm sharing my screen to you. So this is my title of a presentation of my talk today. That one is the Glimepiride Nanoemulgel, an innovative carrier with improved anti-diabetic effect. These are the contents of my presentation today: introduction, objectives, methodology, results and discussion, conclusion, and references. Okay, so I will shift into the slide mode now. So far everybody knows about the diabetes. As you can see, diabetes is the 7th leading cause of the deaths in the world now. So everybody knows about the diabetes. What is diabetes? Diabetes is a serious long-term condition that occurs when body cannot produce enough or any insulin that or cannot use that insulin effectively. So there are three main types of the diabetes. There are type 1 diabetes, type 2 diabetes, and gestational diabetes. So in type 1 diabetes, in which body cannot produce insulin, in type 2 diabetes, in which body cannot use that insulin, and in gestational, that can occur during pregnancy. So as you can see, over the past few decades, diabetes mellitus has started to appear as one of the major cause factors of the deaths around the world. So according to the International Diabetic Federation, it is extending at a very alarming rate, with a total estimated increase of 1.151 million in 2000 to 463 million of the world in 2019, and it reaches extent to 529 million in 2021. So that's one. And then also according to the WHO, they say this can rise up to 700 million in near future. So according to the what are the consequences of that? The biggest irony of diabetes is that it is a lifelong condition which can accelerate from massively reduced insulin secretion and impaired glucose use to pathological variation in numerous body parts and their systems. So some of the most commonly affected systems that can be affected from the diabetes are the eyes, kidneys, nerves, and heart as well. So what is the treatment option for the diabetes? Treatment option for the diabetes is currently there. Nowadays, people are using exogenous insulin therapy, and oral or hypoglycemic agents have been used. So both of these treatments are associated with the so many number of issues, including reduced effectiveness and tolerability, and also it's very difficult to control the diabetes and management as well. So keeping in view this one, the severity of the current situation, two possibilities can be possible. Number one, we can introduce the newer diabetic agents, obviously, which is a lengthy process and may take years. And second one, we can improve the available therapies of diabetes, which is looking more suitable for this. So that's why here our objective, we attempted to improve an already available anti-diabetic therapy. That one is Glimepiride. So everybody knows about Glimepiride. It is the third generation sulfonylurea oral hypoglycemic drug. It is broadly utilized in the therapy of non-insulin dependent diabetes mellitus, as it is involved in increasing the production as well as the sensitivity of the insulin. So basically, it is one of the most prescribed drug for controlling of the diabetes, but its per oral administration is connected with so many side effects, that is hepatic first pass metabolism, low and inconsistent bioavailability, large disparity between the subject concerning dose and some serious side effects such as low blood sugar, headache, lightheadedness, anemia, and stomach problem also can occur with this. So, which can further reduce the patient compliance and adds to the patient discomfort as well. So, interestingly, most of the issues of this drug are imparted to its poor physiochemical traits, properties. Regardless of the potent therapeutic outcome, its poor aqueous solubility and lipophilic character restricts the drug dissolution, leading to decreased drug absorption and ultimately the bioavailability. So, in order to uh, address these concerns, numerous efforts have been made through the most distinguished strategy was employed where the delivery through the skin. And this could not be only happened and then that can extend the half-life as well. But most importantly, it can enhance the patient compliance as well and can avoid the side effects uh, as well. So in addition, this delivery can also be revolutionized for the treatment of the lifetime conditions which cannot be cured and need continuous therapy. However, only few efforts have been undertaken to deliver glimepiride across the skin, which mostly consisted of transdermal films as well as patches, even though these deliveries also incorporated nanolipid vesicles and self-nanoemulsifying approach. Yet, these are not still sufficient enough to permeate the stratum corneum and require organic solvents as well as the chemical permeation enhancers. So the difficulty with these chemical agents is that not all the efficacious enough to exhibit good infiltration and the potent one goes associated with good efficacy as well. So previous studies have demonstrated that the use of the self-nanoemulsifying particles to increase the effectiveness of the glimepiride, but the drawback of the transdermal carrier is that they are only appropriate for smaller molecules that can easily penetrate stratum corneum. So recently, a new drug delivery system, namely Nanoemulgel, has been reported for the topical delivery of the lipophilic drugs, which can offer the enhanced solubilization, enhanced viability, as well as safe and superior permeation as well. So this delivery system is basically actually an intervention between the two different systems, namely nanoemulsion and gel. So topical nanoemulsion formulations are well known for their ability to enhance skin permeation by temporarily disrupting the highly organized structure of the skin and the potential of the topical nanoemulsion to deliver glimepiride was still unexplored. So these are the objective of my work. So in order to enhance the ability of the glimepiride to permeate the skin and to provide a more efficient therapeutic effect in comparison to the previously reported studies, a nanoemulsion based gel of glimepiride was designed. So the unique feature of our study is that we introduced a new concept for the incorporation of solubility enhanced glimepiride that will be made of glimepiride, cyclodextrin, and gel-O-Shire 44 by 16 into the nanoemulsion based gel that is called nanoemulsion, and we evaluated its permeation and hypoglycemic effect against the pure glimepiride and the marketed brand. This is the methodology. And first, we prepared the inclusion complex for our glimepiride complex. As you can see, we prepared the ternary complex by a ratio of 1 into 10 into 10% by kneading methods. This one is the previous finding that we published already. So for the nanoemulsion, we did the solubility studies and then I have made the phase diagram by water titration method and then we made the nanoemulsion formulation by spontaneous emulsification method and characterized for pH, viscosity, conductivity, particle size, eta potential, and polydispersity index as well. So for the nanoemulgel, initially we prepared the gel base by using xanthan gum. Then after that, we incorporate this nanoemulsion into the gel base by ratio of 1:1 at a speed of 250 RPM for 15 minutes. Then after that, we characterize this for pH, viscosity, drug content, ex vivo permeation by using France diffusion cell. And then after that, we performed in vivo antidiabetic studies and skin irritation studies as well. This is our flow sheet diagram of for our work. As you can see, in start we use the clove oil, glimepiride, and then after that we prepared a complex of glimepiride and crude complex with beta cyclodextrin and gel. Then this ternary complex of glimepiride we mixed with the clove oil, and then we have made the nanoemulsion, and then water cis, and then after that you can see the clove oil nanoemulsion was made. Then after that, this nanoemulsion we incorporated into the gel base. Then after that become nanoemulsion, and then we use for by using animals we determine our anti-diabetic activity and skin irritation studies as well by performing histopathological studies. So these are the results of my the inclusion complexes. As you can see, both binary and ternary complexes of glimepiride were successfully prepared and then evaluated its solubility in water. Solubility of both binary and ternary complexes was found to be increased up to 25.97 microgram per ml to 43.29 microgram per ml respectively, in comparison to pure glimepiride, that is 1.21 microgram per ml only. That it's clearly indicate the behavior of the cyclodextrin and gel to increase the solubility of glimepiride than glimepiride. So this was our previous finding we published already in ISI Impact Factor Journal. So from this study, we already took our ternary complex. This one already published. Then after this, for making the nanoemulsion, we have to select different oil surfactant and co-surfactants. So because the selection of the oil phase is very highly critical for this to making the nanoemulsion, because it is accountable for loading the drug and maintaining it in a dissolved state in the nanoemulsion system indirectly. So amongst all of the oils that were evaluated, you can see the highest solubility was found to be observed with the clove oil, and then it was selected as the oil phase. For the surfactant and co-surfactants that everybody knows assist in reducing the interferential tension between the two phases by adsorbing at their interface and provide a mechanical barrier against the aggregation or coalescence. So in the case of surfactants, a non-ionic type is mostly preferred in comparison to their ionic counterpart that are often associated with numerous toxicity and bioactivity related concerns. So non-ionic surfactants are considered to be safe due to their hydrophilic nature. Therefore, in this study, we use only non-ionic surfactants. So for this surfactants, you can see that 2 in 80 exhibited the uppermost highest solubility in terms of solubilizing glimepiride and therefore selected for further investigation. So besides that, 2 in 80 also has an HLB value of 14.5, which can ensure the corresponding oil in water microemulsion type. So among the co-surfactants, polyethylene glycol 400 shows the highest solubility of glimepiride, that is 1.77 milligram per ml. That one, the polyethylene glycol was selected. So then after that, we have made the pseudo-ternary phase diagram by water titration method. So we obtained, as you can see, the highlighted region, the black region, we obtained this nanoemulsion, microemulsion region. From this region, we selected the 3 formulations were selected for the development of nanoemulsion, which are presented in the table. You can see in the table 2, that one is the formulation 1, 2, and 3. In this, it is already you can see the different composition of oil, surfactant mixture, and water. Then after that, this one is the physical characterization of our glimepiride microemulsion, nanoemulsion formulation. As you can see, the appearance are very transparent in nature. All the blank glimepiride and glimepiride, including complex loaded nanoemulsion formulations, all were transparent and uniform in nature. This one is the results of the viscosity and the pH. So as you can see from the viscosity curve, it was apparent from the data that the developed formulation had the lowest viscosity. So an increase in the, you can see an increase in the viscosity value was found from NF1 to NEF3, as you can see from the viscosity curve. So when the concentration of the oil 10 to 15% and the surfactant mixture increased from 35 to 40% and the water content decreased from 55 to 45% in the nanoemulsion 1 and nanoemulsion 2 formulations. So the increase in viscosity was owed to a higher internal phase ratio in an emulsion system. So the viscosity of the nanoemulsion formulation third further increased when the amount of the surfactant mixture increased and water concentration decreased. So this increase could be due to the presence of highly hydrated hydrophilic chains of the surfactant known as that is 2 in 80, so that are strongly connected together through hydrogen bonding, allowing for stronger interaction. So from the pH, as you can see, the normal adult pH skin falls between the 4 to 6.5. So, but pH values ranging from 5 to 8 are unobjectionable for skin application. An increase in pH values after the incorporation of drug ensured its acidic nature. So these are the results of our electrical conductivity and the particle size. Electrical conductivity was done to find out the type of the emulsion. So typically oil and water nanoemulsions have the higher electrical conductivity values from 10 to 100 in comparison to oil and water nanoemulsion system from 10 Siemens per centimeter, owing to the conductivity properties of their outer aqueous phase. So electricity, as you can see from the curve patterns, electrical conductivity values were found to decrease with the decrease in the amount of the water in the system. So for the particle size, the mean particle size of all the blank microemulsion formulations varied from 133.4 to 157.9 nanometers. So in the case of the glimepiride and glimepiride loaded cyclodextrin with Jalosha loaded preparation, the particle size were between 141 to 213 nanometers and 143 to 233 nanometers respectively. So size increased from formulation F1 to F2. It was observed that the particle size in formulation nanoemulsion 1 and nanoemulsion 2 formulation increase as the content of the glow wall increased from 10 to 15% weight by weight. So an increase in the particle size with the increase in glow wall content was seen due to globule expansion in the droplets. So far, for the formulation from F2 to F3, in which the size decreased because the oil concentration we kept the constant and the amount of the surfactant and co-surfactant increase in formulation, nanoemulsion formulation third from 40 to 45%. So in which the particle size decreased. So decrease in particle size could be due to the presence of the proportion of the surfactant in opposition to the co-surfactants, because the surfactant and co-surfactants are involved in the condensation and expansion of the interfacial film respectively. The surfactant used in the system is 280, which can also achieve small mean particle size as it is an esters of long chain fatty acids. The appropriate amount of surfactant has an influence on the particle size. So these are the results of our zeta potential and polar dispersity index. Zeta potential is usually an indicator of the stability of a nanoemulsion system. So it is evident from the our result that higher the zeta potential values ensure the higher stability. So however, these values are not reliable for the assessment of the stability, as the literature shows a wide range of these values ranging from 1.5 to 45.5 million volts. So value of the zeta potential all the values of the zeta potential we found for our formulation were negative in the range of minus 12.8 to minus 20.7 million volts. So nanoemulsions, if they have a negative charge on their droplets, that is due to the presence of electrostatic repulsion charges, which guarantees the nanoemulsion particles is free from coalescence and a well-separated emulsion system. So far, for the polydispersity index that determines the measure of the particle size homogeneity. So normal values for PDI ranges from zero point 0 to 1. So in our results, the polydispersity index of all the formulations were less than 0.5. That shows a narrow and uniform size distribution as well. So this one is the how to prepare the nanoemulgel formulations. You can see from the nanoemulsion system, we also prepared the three formulation for our nanoemulgel preparation. We used the xanthine gum in the percentage of 3%. And then we prepared the nanoemulgel formulations. So far, after that, we performed the same thing for the we characterized the nanoemulgel formulation as well. So far, you can see the pH remains ineffective as well. No change in the pH found when it incorporated into the nanoemulgel formulation. As you can see from the viscosity curve, that the viscosity is going to increase a little bit when it incorporated into nanoemulgel formulation. And then after that, when you see the drug content, no drug loss was found when the drug nanoemulsion formulation was incorporated into the gel base. So it means the pH of the nanoemulsion formulation is safe. Viscosity has already found the sufficient viscosity of the gel formulation, and no drug loss appeared in the nanoemulsion formulation. So far, for the ex vivo permeation studies have been performed. All the, as you can see from the curve, all the nanoemulgent formulation displayed a steady rise in glimepiride permeation over time. The results showed that the glimepiride loaded nanoemulsions presented the superior permeation when compared to the glimepiride clove oil and the glimepiride aqueous suspension. So the overall permeation order that was observed, that the highest rate of the permeation was observed with the nanoemulgent formulation, that is with the loaded with the inclusion complex, then the nanoemulgent formulation, then the lowest one is the glimepiride clove oil, and then at the end the last one glimepiride aqueous suspension, as you can see from the permeation curves. Among the glimepiride loaded formulations, NEG1 exhibited the superior release than the other formulations. So similar patterns were also seen with the glimepiride, cyclodextrin, gel loaded formulations, which could be explained on the base of their comparatively smaller size, lower viscosity, and high water concentration. Smaller droplet diameters offer a great interfacial area for dissolution and establish closer dermal contact, allowing for higher drug penetration, and then thus can evaluate the drug content at the target site. So higher water concentration is also associated with the better skin hydration, which causes the cornea cells to encourage and making the channels. The hydration also causes disruption in the chain effects to these cornea cells, consequently leading to the disruption in the lipid bilayer and enhanced permeation as well. Okay, so F1, F2, so you can see there's the all permeation profile. So after this, we just measure all the nanoemulsion formulation for flux and the permeability constant we measured. So nanoemulsion formulation consisting of glimepiride, cyclodextrin, and gel expressed the higher flux values in comparison to the glimepiride loaded nanoemulsions. So the higher flux values could be due to the ability of the cyclodextrin to liberate more drug molecules from the complex. So as a result, you can see a higher amount of the free drug is available and leading toward the higher flux values. Both drug flux and permeability constant values for all the nanoemulgent formulations were found to be highly significant when compared to the control groups. Control groups glimepiride in clove oil, glimepiride cyclodextrin and galoshare in clove oil and glimepiride aqueous suspension. This further validate the enhanced permeation from the nanoemulgent formulations. Sorry. So statistical evaluation of the permeation data also revealed the significant and significantly enhanced permeation parameters, flux and permeability constant of nanoemulgel formulation 1C when compared to nanoemulgel without inclusion complex. So, however, other formulations didn't show significant difference in these parameters for inclusion complex as well. So these are of our in vivo antidiabetic results. As you can see from our curves, group 1 is showing the normal group and group 2 is the diabetic group, exhibited no significant reduction at all when compared to the corresponding control group at 0 hour and were found to be non-significant. And the group three, that one is an oral standard group, significantly reduced the hypoglycemic levels from the initiation of therapy, that is, after 2 hours upon comparison to its relevant control at 0 hour, but managed only to sustain it for 6 hours. Group 4, 5, and 6 displayed significant lowering in the blood glucose levels from 4 hours, but group 6, that is loaded with glimepiride, cyclodextrin, galoshare, nanoemulgel, showed the highest glycosemic effect in comparison. So it is evident from our finding that the simultaneous delivery of clove oil and glimepiride from nanoemulsions means group 5 and 6 exhibited higher hypoglycemic activity in comparison to the blank nanoemulgels using clove oil only. That one is represented by group 4. So this enhanced hypoglycemic effect could be due to the improved solubility and in vitro permeability of the drug. So it means a higher degree of retention was also observed with the glimepiride, cyclodextrin, galoshare loaded nanoemulgels that can expand the release period up to 24 hours and can change the overall hypoglycemic effect as well. So furthermore, in this, the role of beta cyclodextrin as a permeation enhancer may also be considered. So as a result, nanoemulgel formulation 1 inclusion complex loaded in showed the greatest permeation outcomes. So this is our histopathological and skin irritation studies. As you can see, no markings of any irritation or inflammation were appeared in the skin microscopy with either blank or drug-loaded nanoemulgels in comparison to control group, which demonstrated the intact stratum corneum, collagen fibers, and appendages with no markings of any inflammatory cells as visible you can see in the figures. So figure 1A is representing group 1 is a no application. B, you can see is the 1B is the group 2. Blank nanoemulgel formulation. C, group 3 nanoemulgel 1. D, group 4 nanoemulgel 1 formulation. Skin structure, stratum corneum, SC. This is representing from this. So then after this, the conclusion at the end. So as our studies presented that, so glimepiride nanoemulgels have both pure as well as pure complex glimepiride were successfully prepared and evaluated. So Preparation of nanoemulsion formulation using clove oil to address the issues of poor transdermal bioavailability for compounds such as glimepiride have not been investigated before. So incorporation of solubility enhanced glimepiride cyclodextrin gel or shire significantly improved the in vitro release and skin absorption of the glimepiride, and nanoemulgel provided an efficient carrier for the topical delivery of both glimepiride and solubility enhanced glimepiride as well. These are our reference. So this article, this study we have already been published in the ISI Impact Factor journal. That one is Cells. And thank you so much. And thank you so much for all the organizers or the listeners who have attended my presentation. And thank you so much. And thanks so much from my all side.